If you don't have the flu or a cold right now, consider yourself lucky. You likely know people who do, and hospitals report record numbers of serious illnesses, not from COVID, but from the flu. As my doctor explained to me this morning, for 2 years, we masked up. Nobody got the flu. Now it's like a combine through an Iowa cornfield because our immune systems just aren't ready to deal with what we used to deal with all the time. Consider these numbers. For the flu, the season runs October through March. We already have 9 million flu cases. That's about the same as in all of last year. It's only early December. 2020, we basically didn't have the flu because of COVID shutdowns. Before the pandemic, we had 40 million flu cases in a full year. We're already on pace to shatter those numbers. In fact, Tamiflu, the one drug to treat influenza, is already extremely hard to find. Of course, there's antibiotic shortages as well because of the RSV virus in kids. In Chicago, the health department reports a 28% positivity rate for influenza. That's almost unheard of. Dr. Amesh Adalja is here, senior scholar, Johns Hopkins Center for Health Security, adjunct assistant professor at Johns Hopkins University. Doc, it's good to see you as well. Thank you very much. Is this really as easy to trace as our immune systems for 2 years kind of got a break, save COVID, and now everything's back?
Well, I think that's part of it. The fact that the number of susceptible individuals to influenza went up because some of our immunity against flu fell because 2020, 2021 seasons were very sparse in terms of flu because of all of the masking, the remote work, schools being closed. But one of the things that I would also highlight is the fact that our vaccination rates are low this year for flu as well. And people are socially interacting. These viruses weren't going to be dormant forever. They were always going to come back. And I think what's happened, just like with RSV, is more people are susceptible to it. But with flu, we do have tools like the vaccine, and we've seen vaccination rates slip. And I think that's something to worry about.
It's hard to find this in terms of data. 41% don't plan to get vaccine. That's equal to 4 in 10 people for the flu vaccine. 53% very worried about COVID infection. Only 20% very worried about a flu infection. I'm worried about both. I was in the hospital with COVID. The one time I had the flu, I thought to myself, I wish I was in the hospital because I felt so sick. But that said, how much do we trace the lack of people wanting to get a flu vaccine? 59% of Americans say they're not going to. How much do we trace that to the debate over the COVID vaccines changing people's minds?
I do think that there has been some bleed from the vaccine hesitancy movement against COVID-19 into influenza, but we've always sort of had lackluster flu vaccine numbers. Maybe about 50 to 60% of the population gets vaccinated. It's not high enough to keep flu at bay, but we clearly have seen the anti-vaccine movement, the vaccine hesitancy movement make inroads into other vaccines like influenza, like childhood vaccinations. We've got a big measles outbreak right now in Ohio in unvaccinated children. So that is a concern that we're seeing kind of metastasis of anti-vaccine sentiment to vaccines that people were more willing to take in prior eras.
What's the danger of that? I mean, in terms of flu, if you don't get the vaccine and you get it, you get really sick. Some people die from it. But is it like COVID that all of a sudden it spreads in a way that we didn't know, or is the vaccine for the flu pretty much just about protecting you?
The vaccine against flu is more about protecting you. It does decrease contagiousness, but it's not ironclad. That also depends on how well the vaccine is matched to the strains that are circulating. This year, it looks like it's well matched. But the biggest benefit of the flu vaccine is it prevents you from having severe disease, hospitalization, and death. And that's especially true in high-risk populations. The very old, the very young, pregnant women, those are the priority groups that need to be vaccinated because those are the individuals who get hospitalized with flu. Those are the people who die from flu.
Yeah. No, it's crazy. When I talked to my doctor today, they were really talking about just sort of how overwhelmed they are, which is obviously what we were all worried about with COVID as well. Hey, Doc, it's good to see you as always. Thank you.
Thanks for having me.
Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.